After 100 years in child services, we know this works. We innovate at the intersection of education and mental health because we believe that long-term, sustainable transformation happens when you attend to the whole child. At Momentous Institute, we are passionate about children reaching their full potential and living joyful, productive lives.
As a new teacher, I had a student coming into pre-K that was having trouble forming relationships. I knew that because he was cussing, throwing things, didn't want to be a part of the group. I didn't know how to help him. I needed more tools in my toolbox. And with the help of therapeutic services, I was able to help him, and I knew that there would be hope in the end.
Momentous Institute's work in therapeutic services stems back to 1948 when we opened the nation's first year-round therapeutic camp for children. Today, Momentous Institute's therapeutic services staff has worked alongside over 100,000 children and families to develop strong relationships, social emotional health, and academic success.
At Momentous School, we focus on the whole child, not just their education. Located in Dallas, our school uses a strengths-based approach as we serve pre-K3 through 5th grade. We partner with students and families to leverage social emotional health and strong academics to cultivate a community of changemakers.
Along with therapeutic services and staff, we were able to work together to better understand his actions and emotions. We made a plan so I could build a relationship with him. It included 20 minutes at the beginning of the day where we would work on puzzles. It also included 20 minutes in the middle of the day after lunch where we would read a book right before his nap time. I would sit with him at times and try and co-regulate by breathing and self-regulating myself. That would in turn help him.
In addition to our direct services, Momentous Institute invests in research and training with the goal to reach far more children than we could ever meet directly. As of 2020, we've trained over 45,000 education and mental health professionals on how trauma affects children and families. We also engage in work in communities where children and their families live and work. We partner with existing organizations to create services that can change the trajectory for kids and their communities.
By the end of the year, I had a full toolkit. He had made 180. He was a great friend. He was great at sharing his emotions. He wanted to be a part of the group. My hope for him is that he continues to excel and build relationships.
Children with strong social emotional health demonstrate self-control, communicate well, problem solve, are empathetic, respectful, and optimistic. Traits we typically admire in the people with whom we want to work and maintain friendships.
Research has shown that children with strong social-emotional health have better outcomes. We're also learning that schools that support social and emotional health along with academics can help children achieve better outcomes even in the face of trauma and poverty. And Momentous school graduates are 3 times more likely to obtain bachelor's degree than similar peers. As of 2020, 80% of children who worked with our therapeutic services have significantly improved their social, emotional, and behavioral functioning. But these aren't just statistics. They are brilliant young people capable of forming and maintaining strong relationships and will contribute meaningfully to society.
After 100 years and over 150,000 lives transformed, we are dedicating our next 100 years to ensuring every child has access to mental health and quality education. We invite you to join us because together we can change the odds for children.